The following video is intended to provide a brief overview about joint pain and treatment options. It is not meant to replace any medical consultation or diagnosis. If you have any concerns or questions about your pain, please contact your doctor. The weather. Cracking your knuckles. Or is it just a normal part of aging? There are all kinds of theories about what causes joint pain. The first step to feeling better is to understand your pain. That's why we made this video. In it, we will explain what a joint is, the most common types of joint pain, and treatment options to help manage your pain and improve your quality of life.
At Beaumont, our goal is to help you be comfortable with the options you have in managing your joint pain. We want to help you understand what joints are, how they work, and how they can become injured. In the simplest terms, a joint is where two bones meet. There are many kinds of joints in the body, but they all have the same important parts. In addition to bones and muscles, joints include cartilage, ligaments, tendons, and bursa. On the end of the bones, there is a smooth surface tissue called cartilage. In between the bones, there is another type of cartilage that provides a gel-like padding to help absorb shock and allow the bones to glide smoothly. Ligaments are bundles of strong connective tissue that connect from bone to bone. They provide stability and essentially hold the joint together. Tendons are also bundles of strong connective tissue, but these tissues connect muscle to bone. When muscles contract, the tendon acts like a pulley to make your bones move. Additionally, there are small fluid-filled sacs called bursa. They are found in areas near joints and help cushion joint structures to reduce friction during movement. When joint structures become inflamed, worn down, overused, or even underused, you may experience joint pain. Some of the most common types of joint pain are arthritis, tendinitis and bursitis, repetitive use injury or overuse injury, and joint instability. Let's first talk about arthritis. Arthritis is a disease which causes inflammation along the joint surfaces, affecting the smooth cartilage at the end of the bones. There are many types of arthritis, but the two most common types are osteoarthritis and rheumatoid arthritis. They are very different from each other, but both can cause the surface of the bones to become rough, form spurs, or other irregularities. It can be quite painful to bend and straighten your hip or knee when you have arthritis, and you may also experience joint swelling, stiffness and weakness, or feel clicking or grinding when you move. Tendinitis and bursitis are when the soft tissue structures of the joint become inflamed, irritated, or torn. Some of the ways that we overexert ourselves include working in awkward positions, working overhead, using vibrating equipment, or pressing against hard surfaces for long periods of time, like when kneeling. Lastly, if you have joint instability, you may have injured or overused a joint so much that the muscles, tendons, or ligaments have weakened and cannot hold the bones properly anymore.
Let's now look at the most commonly injured joint, the knee joint. Think of your knee joint as a door hinge. One side of the hinge is attached to the thigh bone, the femur. The other side is attached to the shin bone, the tibia. The ligaments of your knee are like screws that keep the hinges in place. If one of those screws gets loose due to injured tissue, it puts pressure on the other screws, which can cause the actual hinge to become loose. And this hinge that we are talking about is your knee joint. So if your knee becomes loose or unstable, it will eventually damage the cartilage, meniscus, tendons, or joint surfaces, leading to tendinitis, bursitis, arthritis, and joint pain.
If you're experiencing joint pain, here are some of the most common routes to pain relief that you could take. You could do nothing, or the wait and see approach. You could make your best attempt at self-care. You could see a doctor. You may try physical therapy, or you could consider orthopedic surgery. Maybe you just want to wait it out, take it easy, and see if the pain goes away. It's like they say, time heals all wounds. But if time doesn't heal your wounds and your pain just doesn't go away, it may be worth trying a different approach. Self-care. You can try the RICE approach, which stands for rest, ice, compression, and elevation. Rest. can include anything from changing or reducing your activities to resting or trying a cane or walker to reduce pressure on your joint. Ice is as easy as putting a bag of ice or a cold pack in a pillowcase and placing it on your injury for 10 to 15 minutes a few times a day. This can help reduce pain, swelling, and inflammation. Compression. You can try using an over-the-counter compression sleeve or brace, which can also reduce swelling and pain and may keep your joints in better alignment during activity. Elevation. Try putting your leg up on a pillow above the level of your heart to limit or reduce swelling. Usually, the next route to joint pain relief is to go see a doctor, preferably your primary care physician or PCP. Your PCP will give you medical advice, provide treatment to manage your pain, which could include oral medications and/or different types of injections, and they may also refer you for imaging tests like an X-ray or MRI. Your PCP may also refer you to another type of doctor, most likely a physical medicine and rehabilitation doctor, otherwise known as a physiatrist, or they may refer you to an orthopedic surgeon, either of which could also provide some of the above treatments to help manage your pain. Reasons to consult a doctor include experiencing pain, swelling, redness, tenderness, or warmth around your joint for 3 days or more, pain that limits daily activities or keeps you up at night, and/or difficulty performing your normal daily work or family activities. Your doctor may also refer you to a physical therapist or PT. A PT is a highly educated, licensed professional that treats a wide variety of injuries, diseases, and chronic conditions. The main goals of PT are to decrease your pain and improve your daily quality of life. A PT will examine your strength and range of motion, check your balance and functional abilities like walking and stair climbing, and ask you your goals. They will then come up with a personalized treatment plan to relieve your knee or hip pain and restore your mobility. If you have pain or difficulty getting up and down from a chair, walking the distance of a grocery store, going up and down stairs, or you've been avoiding some of these activities due to pain, stiffness, or weakness, it is likely that PT can help. Another option is orthopedic surgery. An orthopedic surgeon is a specialist who treats conditions and injuries related to muscles, bones, and connective tissues. Your surgeon will assess your medical history, perform imaging studies to determine the extent of the problem, and will work with you to determine what type of surgical procedure is best for your unique situation. Some of the most common options are arthroscopic procedures, partial joint replacement, or a total joint replacement. The aim of these surgeries is to correct or remove the damaged tissue, relieve your pain, and improve your quality of life.
As your partners in care, we at Beaumont hope that this video gives you the peace of mind to know that if you have joint pain, you have many options. Unfortunately, joint pain is a normal part of life. The good news is we're here to help.